Preventing type 2 diabetes. You may have learned that you are highly likely to develop type 2 diabetes, the most common type of diabetes. You may be overweight, or you may have a parent, sibling, or family member with type 2 diabetes. You may have had gestational diabetes, which is diabetes that develops during pregnancy. These are just a few examples of factors that can increase your chances of developing type 2 diabetes. Diabetes can cause serious health problems such as heart disease, stroke, eye problems, and foot problems. Prediabetes can also cause health problems. The good news is that type 2 diabetes can be delayed or even prevented. The longer you have diabetes, the more likely you are to develop health problems, so delaying the development of diabetes for at least a few years will benefit your health. You can help prevent or delay type 2 diabetes by losing a small amount of weight, following a reduced calorie eating plan, and being physically active most days of the week. Ask your doctor if you should take the diabetes medicine metformin to prevent or delay type 2 diabetes. How can I reduce my chance of developing type 2 diabetes? Studies such as the Diabetes Prevention Program show that there are many things you can do to reduce your chance of developing type 2 diabetes. Here are some things you can change to lower your risk, lose weight and maintain it. You can prevent or delay the development of diabetes by losing 5 to 7% of your original weight. For example, if you weigh 200 pounds, your goal is to lose 10 to 14 pounds. Move more. Engage in physical activity for at least 30 minutes 5 days a week. If you haven't led an active lifestyle, talk to your doctor about what activities are best for you. Start slowly getting closer to your goal. Eat healthy foods most of the time. Eat smaller portions to reduce the number of calories you consume each day and help you lose weight. Choosing lower-fat foods is another way to reduce calories. Drink water instead of sweetened beverages. Ask your doctor about what other changes you can make to prevent or delay type 2 diabetes. More often than not, the best chance to prevent type 2 diabetes is to make lifestyle changes that will work for you in the long run. Start working on your action plan to prevent type 2 diabetes. What should I do if my primary care physician tells me I have prediabetes? Prediabetes is when blood glucose levels, also called blood sugar, are higher than normal but not high enough to be called diabetes. Prediabetes is serious because it increases the likelihood of developing type 2 diabetes. Many of the same factors that make you more likely to develop type 2 diabetes put you at risk for prediabetes. Other names for prediabetes include impaired fasting glucose levels or impaired glucose tolerance. Some people refer to prediabetes as borderline diabetes. According to the latest diabetes statistics, about 1 in 3 Americans has prediabetes. You will not know if you have prediabetes until you are tested. If you have prediabetes, you can reduce your chances of developing type 2 diabetes. Lose weight if you need to, become more physically active, and follow a reduced calorie eating plan. If I had gestational diabetes during pregnancy, how can I reduce my chances of developing type 2 diabetes? Gestational diabetes is a type of diabetes that develops during pregnancy. In most cases, gestational diabetes goes away after the baby is born. Even if your gestational diabetes goes away, you are still more likely to have type 2 diabetes within 5 to 10 years. Your child may also be more likely to become obese and develop type 2 diabetes later in life. Making healthy lifestyle choices helps the whole family and can protect your child from becoming obese or developing diabetes. Here are steps you should take for yourself and your baby if you have gestational diabetes. Get tested for diabetes 6 to 12 weeks after your baby is born. If your blood glucose levels are still high, you may have type 2 diabetes. If your blood glucose levels are normal, you should get tested every 3 years to see if you develop type 2 diabetes. Be more active and choose healthy foods to get back to a healthy weight. Breastfeed your baby. Breastfeeding gives your baby the right balance of nutrients and helps burn calories. Ask your doctor if you should take the diabetes drug metformin to prevent type 2 diabetes. If you've tried all sorts of diets and they haven't worked, we recommend reading the book Smart Blood Sugar about the way to safely and naturally control your blood sugar levels. The link will be in the description and in the comments.